Hello, everyone, and a really warm welcome to today's eMHIC webinar. I'm Fiona Costello. It is morning for me here in the UK, but good afternoon, good evening, wherever you are in the world. I am so glad you could join us for today's Fireside Chat. Mental health digital transformation, a proven approach for transforming the technology infrastructure of mental health service providers. The mental health sector is under real pressure, with demand for support far outpacing the resources available. Technology and AI offer huge potential to increase access, improve quality, and strengthen risk management, but adoption across the sector has been inconsistent. In today's session, we'll hear from the CEOs of Caraniche and Tacklit, who have worked together over several years to bring real transformation to the way services are delivered in a really novel way. You will hear firsthand how they navigated challenges, what worked, and the measurable benefits they've seen from greater access and better engagement to faster innovation and improved efficiency. You'll hear from our wonderful speakers soon, but first, I just have a few quick things to mention. For those of veterans of the webinars, you'll know what I'm about to say. Firstly, feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose edit, and add your country or area. This allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, which I'm sure you will, please feel free to post them in the Q&A box. During the Q&A session, I will do my best to include as many of them as possible in the discussion. And lastly, as always, today's webinar is being recorded and the eMHIC team will soon share the recording in the Knowledge Bank. So now it gives me great pleasure to introduce our first speaker, Chris Griffiths. Hello, Chris. Chris is
Hi, Fiona.
co-founder and Hello. Chris is co-founder and CEO of Tacklit, an end-to-end operating system for the delivery of mental health care. In this role, Chris leads platform development and supports the digital transformation of mental health service organizations around the world. Tacklit is used by over 80 organizations who collectively support the mental health of over 220,000 people globally. Chris is an experienced digital technology and AI senior leader and has successfully delivered on multiple global technology initiatives in the health, education, employment, travel, and finance industries. He is formerly Chief Product Officer at the True Digital Group and an International Product and AI Director at Seek. What a bio, Chris. Chris is going to kick things off now with a brief overview of the Service Transformation Project, and then we'll be joined by Caraniche CEO Jacinta Pollard for a relaxed panel discussion. We'll have plenty of time for questions, so please get them ready while you're listening to Chris. I can't wait to hear more about this inspiring collaboration. So Chris, over to you.
Thank you. Thanks, Fiona. Thanks, everybody, for joining. Really pleased to be here and to share things that we've learned on our journey transforming mental health care organizations at scale. We've got a couple of slides that we prepared just to try and help guide the conversation a little bit. So I'm just going to talk to one very briefly at the beginning, which is about who we are at Tacklit. So we are a software as a service provider specifically for the mental health care industry. We were founded because my co-founder Rich went through his own lived experience of a deep depressive episode, and it was through the challenges he faced along the journey in terms of accessing and progressing and navigating the care landscape, which led us look into this space. And we founded Tacklit essentially to help millions of people all around the world get access to personalized, proactive, outcome-driven healthcare. And we do that by partnering with care organizations at scale to amplify their impact. So Fiona mentioned we work across the world now with customers in the UK, where I'm originally from. I'm a proud Welshman, even though I now live in Melbourne, Australia. And we have a team across Melbourne, across Kuala Lumpur, Malaysia, in the UK. And we're serving now really interesting organizations who are doing really interesting things with technology and AI to amplify their impact. So we focus a lot on how we can help care teams manage all of the different clinical, operational, and financial processes that they have to navigate in terms of delivering care at scale. And we partner very closely with our customers, one such being Jacinta and Caraniche. And happy to share with you today about how some of the lessons that we've learned on that journey. Thanks.
Thanks, Chris. I would now like to introduce Jacinta to join us. And while she does that, I'll introduce her. Jacinta is a psychologist and the founder and CEO of Caraniche, a leading mental and behavioral health company based in Melbourne. With over 20 years of experience in clinical service delivery, training, and program design, Jacinta has played a pivotal role in shaping innovative approaches to care across both community and correctional settings. More recently, Jacinta has been focused on leveraging technology to enhance access and outcomes in mental health services. It was during this journey that she connected with the team at Tacklit, partnering with them to transform service delivery and co develop integrated digital behaviour change programs at Caraniche. Jacinta is a fellow of the Australian Psychological Society, sits on the board of Tacklit as a key advisor, chairs the EAPAA Committee, and has recently embarked on the Vincent Fairfax Fellowship with the Conlana Centre for Ethical Leadership. Welcome, Jacinta. Over to you.
Thanks, Fiona. Lovely to be here. So I'm assuming the slides are up, Chris? Brilliant. Thank you for that. All right, so just to give you a little bit of context about who we are, so you can think about whether what we're doing is relevant to your journey. Caraniche has been operating for 30 years, mostly in the social justice space, so a lot of work in the prison system, working with offenders, both in the community and in custody, and with youth justice as well. Currently, our focus is on working with offenders in the community, mostly with substance abuse issues, mental health and trauma. Another part of our business is working in corporate settings with workplace services, delivering EAP and wellbeing programs and managing psychosocial risks with a wide range of employers. Although we do focus on agencies who work in the same sectors as us so that we can actually bring our sort of frontline clinical expertise into supporting their workforce. So emergency services, education and health is our primary focus. So we've got two quite different clinical service arms. And alongside those, we've got a behavioural health arm, which we established as a digital first part of our business. Again, delivering similar types of services around addictions and behavioural health issues, including emotional regulation and anger, but that's actually a direct to consumer. So a lot of our other work is under contract to either government or corporate organisations, but our behavioural health service is actually a direct to consumer service. So it was a different way of delivering the same types of services, and fundamental to our starting conversations with Chris and his team in terms of how do we reach more people at scale. In terms of the types of work we do, like most clinical service agencies, we do a lot of individual work, but one of the things that does make us different is we also do a lot of group work, and some of our clients will be in both individual treatment and group treatment at the same time. So part of our tech support needs to be able to navigate some of those complexities. And a lot of our group work is structured CBT type programs where you're wanting people to go through a structured process. So having a platform that can support that and support both individual and group was really, really important to us. So that gives you a little bit of a sense of our context. Thanks, Chris. In terms of the set of problems we needed to solve when we started the conversation, which I think are problems that nearly all clinical and health organisations are grappling with at the moment. We had a range of operational issues, largely driven by workforce shortages. And in Australia, there are incredible shortages of clinical workforce. I don't know whether it's the same in the rest of the world. I suspect that it is. But those workforce shortages meant that we had huge client demand with really long waiting lists. Our traditional models of care, which were very much face-to-face, were disrupted through COVID. And we needed to find new ways to work, and we couldn't support our government clients in increasing access because we were doing largely face-to-face work. So we needed to scale, and we had a lot of time-wasting manual processes sitting behind our services delivery, so that didn't help us in our trying to get to more clients more quickly type of journey. And there was a lot of difficulty in administering group delivery. So anyone that's trying to use platforms to deliver groups will know that you're managing each of the members of your group as an individual client and setting up individual records, which just complicates the effort in administration. On the tech side, I'm ashamed to say that we had been on quite a long tech journey that wasn't really delivering results anymore. We had a lot of legacy systems that we'd over customized, so they weren't really working for us anymore, and we couldn't get good tech support for them. And on top of that, we had lots of bolt-on applications. While we were trying to adapt to new ways of working, we were putting more things on top of a platform that was already stretched within an inch of its life, and it wasn't integrated. So, things were becoming more and more complex and complicated and difficult for us to manage, and we knew that we needed to get a solution in place pretty quickly. Alongside that, because of our government contracts, we had really complex data wrangling requirements to try and meet what were ever changing reporting requirements. So having our data in a system or organised in a way that we could adapt and respond to changing contract requirements was becoming a great challenge for us. And certainly, we were tempted by new tech, but we really didn't have any way to leverage it while we were already sitting on what felt like a little bit of a house of cards. So we needed to do something, and we needed to start, with quite open eyes to what the possibilities were. In terms of where we are now, I think I might be sort of giving away the punchline at the beginning of the joke, and I hope I'm not. So now where we are, having done the work with Chris and his team, we've got an integrated platform that supports all of the delivery requirements. So from assessment and psychometric tools all being done through the platforms, through communications to our clients, scheduling, clients being able to self-book, monitoring through mood tracking, monitoring activities that people are doing, data collection, and then actually the delivery itself happening through the platform. So it's all sitting in one place. We're not bolting things on. It makes it feel much more contained, much more manageable. We've got much better visibility. And of course, it's much more secure in terms of our data security requirements as well. So that's kind of where we are now. Our delivery is supported directly by the platform. We can bundle clients into groups so that we can manage them as a one and have that group of people who've been identified as a group treated with the same communications and same sort of summaries going into files and things. And we've got a lot more automated processes sitting underneath us. So a part of the journey of discovery is really, what do we want to automate? How do we want to automate it? Which I'm sure we'll talk about a bit more. And we've got a data pipeline that supports our reporting, so we can get at our data more easily, we can pull it out, we can construct it in the way that we need to present for our reports. And all of that has given us a bit of a platform, a safe and reliable platform where we can start to look at things like AI and leverage AI. And we've started that journey with an early pilot, which I'm sure we will get to in more detail in a minute. I think that was my bit.
Right. Thank you, Jacinta. So yeah, we've put together, Jacinta and I paired to kind of try and distill a very short, TLDR version of the journey that we've been on over these last few years. So we've kind of got 5 kind of things that we just thought we can rattle off at the beginning of this conversation before kind of Fiona comes and guides us through some of the more detailed discussion. And I guess these are our reflections on why ultimately our partnership has been successful. So the first thing that kind of I take away from this was there was a lot of collaborative thinking done up front. And this, I think, is testament to the way that Jacinta and her team approached the challenge and how they engaged with us as an external partner. So there was a really nice balance and blend of involving frontline staff, clinical staff, frontline support workers, as well as the admin teams that sit behind them running the day-to-day with the top-down strategic leadership. So by having kind of both of those elements of the organization in on the ground floor, if you like, we were able to build a view of what each individual kind of user needed and the particular problems and challenges that they faced in their role. And I think having both of those partners together in the room was really, really valuable. I think the other thing as well that we learned was we were treated by Jacinta and team as a partner. So we were not treated like a vendor. I think this was really, really important for us being able to unlock specific ways in which we could solve problems together. So kind of it wasn't like necessarily us kind of replying back to a very formal tender process, which have a role to play in kind of, these things. You've always got to be able to assess partners and try and figure out who you should be working with. But I think what we really liked about the collaboration with Jacinta and her team, and something we learned with Jacinta and we've taken on to our other customers as well, is really bringing that partnership approach, trying to understand deeply the problems that are trying to get solved, and working together to figure out ways in which we can do them.
Yeah.
The second, please, build on anything I'm saying, Jacinta, as well. Don't let me whittle on without you adding your insights in. The other thing I think that we did was, had a really sensible approach to how to take on what was a big transformation, but essentially kind of, eating the elephant kind of one bite at a time type thing. So finding ways in which we could sequence and phase things to create the opportunity for more feedback loops, build momentum by, by learning and then adapting for kind of the next phase of the program. So this kind of idea of trying to find the right parts of just into services to start with, finding internal champions who are excited to go on the journey, basically taking those things almost one step at a time allowed us to deliver value faster because we weren't trying to do everything kind of out of the gate at one time. And it gave us the opportunity to learn and build on successes.
And I'll just chip in there, Chris. So the first project we did with Chris and his team was our program called Kickstart. And that's a group-based program, and it's one where clients had a lot of difficulty accessing it if they're in. It's a mandated program, so people couldn't access it coming face to face. So by being able, we made a decision. We really wanted to put that online to make it more accessible, particularly to people in regional and remote areas. But the beauty of that, it was already a proven program. It was already structured. We knew the content, so we knew that it worked. We knew that it was effective, and we had a small group, a small team that delivered that for us. So, working that a known product through and creating a designed for digital version of it and putting that on the platform meant that we'd kind of taken out a lot of the room for error, and we could just go on the journey in terms of what does it mean to digitize, what does it mean to put something on a platform, how do we leverage what Chris and his team are able to offer us. And that certainly, was the start of that journey of building confidence that this really makes a difference and it really works well.
Right. And it kind of leads nicely into the third point, which is kind of, I guess, really making sure that those early wins are kind of, we're loading the deck a little bit in terms of having the right people involved, making sure they get, lots of attention, lots of communication around it, and celebrating those successes. Again, I think building that buy-in, for us as a new partner working with Caraniche, there was obviously a level of trust that we had to earn. And the best way for us to do that was showing that we could actually execute and help. And, kind of the way that we engage on a day-to-day basis and doing the things that we say we're going to do was a really big part of building that trust. And then I think internally, as we start to build some of that momentum, those champions then, rolled from one part of the project onto the next part of the project. So we were kind of building on that halo effect of getting some runs on the board, if you like, in terms of delivering value, and then having, those people seed the team for the next part of the transformation and bring in a lot of that confidence and energy. So kind of, I think it's a real balancing act in terms of you need to have those internal champions, to be the advocate, to be the person who can answer questions and can help people, troubleshoot kind of day to day, as well as the partner doing as much heavy lifting as we can to kind of to make the team successful.
And from my perspective, I knew that we were on the right path when I started to hear the clinicians actually talking about the benefits. So the tech people could see the benefits, the project team could see the benefits, the executive understood there'd be benefits. But when the clinicians can start saying, when we can hear them say, I really like the way this is happening and I really like that, and you start to hear that positive language out there amongst the team talking amongst themselves, and then the other teams are wanting to know when they're going to get it. We knew that we'd hit a tipping point when other teams wanted to know when they were going to be next to go online on Tacklit.
But things, as always, with change, is not plain sailing. So again, there are always bumps and things that come up along the way. Um, I think one of the things that we like as an operating principle is being stubborn on the vision. So you know where you're trying to get to, you know, the overarching kind of objectives and what success looks like, but then being able to be flexible on the detail and respond to change as you go, I think is a really important thing that we learned with Jacinta and team. And again, I think it's testament to Jacinta's organization that they embrace this mindset as well. So it was kind of when, you know, when things got hard or things came up unexpectedly, or, you know, or execution didn't go as we wanted, having a mindset around reacting to that change, problem solving, continuing to push forward, because what's important is the vision rather than any kind of minutiae kind of particular details that you might have to adapt and change along the way. So I think constantly reminding ourselves of that, sometimes a bit of kind of gallows humor at times when you're in the trenches in terms of, you know, doing the work, but taking the time to reflect on those things, keep coming back to that point around what the overarching vision is, you know, and this goes back to that point at the beginning, which was that balance of top down and bottom up kind of engagement. You know, I think Jacinta and team did a really nice job of being able to, you know, when the going got tough, you know, Jacinta, Anne-Marie, other leaders in the organization could, you know, G up the troops, if you like, remind them of the overarching kind of objective, and keep, you know, keep progressing towards that. So I think expecting that and planning for that, even though you might not know exactly what exactly wheel's gonna come off or what thing's gonna surprise you along the way. I think that's a really important part of any successful transformation project.
I know there was a couple of meetings there when the team was getting a little bit stuck in the minutiae of detail, and Emma and I had to kind of come in and remind people of why we were trying to do this, and you know that we needed to keep the momentum going and not get bogged down in tiny things, because so often people are trying to replicate their current ways of working within the platform, and you know, clinicians are very focused on what works. They know what works for them because they have the benefit of that real-time feedback with their clients, and they often lose sight on some of the other things we're trying to gain. So coming back in every now and then and reminding people of what we were trying to achieve and why, and the bigger picture, and that we didn't really want to focus on replicating existing workflows. We actually wanted to find ways to work better and more efficiently and build that in from the get-go. So yeah, it was important that every now and then we just popped in and reminded people of the big picture goals.
Yeah. And then, so then the last point again is kind of kind of building on the kind of themes that we've already kind of raised, but is that iteration and that expanding. So again, for us, I think that working through, you know, a whole of service transformation is always more successful, whereby we can phase delivery in a way whereby we've got the opportunity to learn and build on, you know, getting more feedback loops in place. And I think, again, that kind of goes to that principle of confidence growing across the organization, solving problems as they come up. And to Jacinta's last point, starting to find better ways of doing things. I think that's one of the things that we've seen from Jacinta and, again, lots of our other customers, which is they start to use our platform and our tools in a, you know, probably bringing the historic kind of, this is how we've done it, therefore this is how we'd like to do it, but then starting to realize what is possible and what changes that you can make to actually adapt and improve things. And so that's a really important part, I think, of that journey, to learning a new platform, understanding what it can do, and then figuring out how you can, you know, pull the levers that it provides to actually enhance your workflows as well. So yeah, that's a really big, I think, a big part of why we've been so successful with our work with Jacinta's team, is being able to kind of bring that to life. And now we have the team pushing us for things that they need or want. And, you know, it's fantastic to have that relationship now whereby essentially Tacklit's product roadmap is driven by our customers and the people we engage with day on day, telling us how we can solve problems for them, how we can improve things, stuff that they would love to do. Yeah. I'm going to stop there sharing. That was kind of our quick whistle stop tour through some key highlights and key lessons from our perspective. So I'm going to wait for Fiona to jump back in and guide us on the rest of the conversation.
Thank you so much. Excuse me. Thank you so much, Chris and Jacinta. Um, Before we jump into the discussion, just a quick reminder to our audience, please post your questions in the Q&A box, and I'll do my best to bring them into the conversation. Um, I just wanted to ask, in terms of some of the drivers of this project in the first place, Jacinta, what specific initiatives delivered the most impact in terms of access, engagement, innovation, or efficiency? I think the efficiency and productivity is quite interesting, particularly in the context of some of the challenges you were talking about around those resource constraints and what that means for delivery.
That's a multi-layered, complex question, Fiona. I think, from a client perspective, it was about access and being able to see more people and reducing the strain on clients having to come to us. So actually getting out there, being digital, moving away from face to face. So that was one perspective, and making it as easy, taking some of the friction out of accessing treatment that clients have. So enabling them to book in their appointments, them choose, for some of our services, they can choose their own clinician. They can schedule their appointments in advance. So if they've got restrictions on their calendar, they can have that booked rather than, never being sure. So there's a large part of it that was about better access to clients, better service to clients, better choice for clients. Then obviously there was a lot of our clinicians' time and the sort of the cognitive load of the work was just grappling with admin and inefficient systems and ways of working that, we're still using Excel spreadsheets and things like that to coordinate. We have quite a lot of large teams and people that work across teams, so the need to coordinate activities across teams and across people. So we needed to have a way to pull all that together where we could see it, and enable teams to be more flexible. So that was a big part of it. But then obviously we because we had these bolt-on systems, like our systems were really, we'd allowed them to evolve over time in response to the needs we had on the ground at the time. But then it just got really unwieldy and heavy. We had to put on quite a large tech team just to maintain it, just to be able to extract data to support our reporting. So we ended up with an inefficient system that required a large team around it to actually get what we needed. And certainly one of the big benefits of moving across to Tacklit has been we've very significantly downsized. We've downsized our internal support team by about $500,000, because we just don't need to wrangle things the way that we have to and continually work to keep things up and going. And it's you don't know what's possible when you're working with legacy systems. You just don't know how far the world has moved on when you're and bogged down in that, and then suddenly this whole other world opens up to you and your clients and your staff. And it is a world of possibilities. Like Chris said, suddenly the staff are asking for things, and there's whole other ways that we can be working. So it sort of generates a whole new way of thinking about what you do and how you do it.
Absolutely. When we were planning for this webinar, you gave some really interesting examples of how you engage with your service users in terms of supporting them to engage with this new approach. I think it would be really valuable for our audience to reflect on that a little bit.
Yeah, so that was talking in particular about one of our programs, Kickstart, which was the first program we put onto Tacklit with Chris and his team. So it's a group-based program for offenders in the community. They're mandated to do it. It has 8 sessions, so they have to keep coming in order to meet the requirements of their court order. But a lot of these people have been in jail. They're not particularly tech savvy. Digital literacy is a real problem for them. So we've certainly, we kind of all jumped into this will be great. And certainly in some of the early iterations, the clients really struggled with it. And, not all of them were digitally literate. And then that was obviously quite compromising for the clinicians. They don't like to put their clients in a situation that's difficult for them to navigate. But over time, we actually found ways of working with that. So our current way of working is that we have a bit of tech support at the beginning of the first 2 sessions of that group. We have a breakout room. So anyone that's having trouble logging in or getting access to things, getting access to the platform and getting onto the program, we put them in the breakout room so they're not under pressure or stress. They get a little bit of support to guide them through. And often it's really simple things like they've forgotten their password, which is not a major tech problem, but they then get into angst and it becomes quite distressing for them. So it can become quite a barrier. So all we're doing now is the first 2 sessions, a breakout session for people who are having trouble. The last time I actually sat in and observed a program, we had 12 guys in the program, 9 of them no problem whatsoever. They would first session straight in. 3 of them needed some time in the tech support. But they actually managed it really, really well, and sat back from that and thought, well, that's actually a really great lesson for them. They're improving their digital literacy. They're learning about tech navigation, which that is the way of the world. We all need to be able to deal with it. And they were supported through that process by the clinicians, So, it became quite a therapeutic thing for them. So what was initially a barrier actually became a learning opportunity and a therapeutic opportunity for them as well. And so usually by session 3, everyone's on, everyone can manage, so we're giving them a therapeutic experience, but we're also giving them some tech literacy as well, which I think is a double benefit.
I think the
Yeah, absolutely.
the piece that kind of resonates for me here as well is going back to that design principle we mentioned, which is by involving the clients in this process and by having a close collaborative relationship, like we were able to actually triangulate and understand the nuances of, this particular cohort, what their lived experience was like, the challenges, etc., that they may have faced around, not having access to a device that was their own, or not having access to potentially reliable internet. So by working together and actually approaching this as a problem to solve collaboratively, I think was really powerful. And again, kind of using that cohort, it kind of, they were particularly difficult because that cohort has some kind of idiosyncrasies that kind of are quite unique. But by us being in the room together, we were able to kind of actually understand these things early, iterate quickly, make enhancements and stuff to actually kind of bring that. So that was a really big part of why it was successful. I think if we were hands off and had thrown a platform to Jacinta's team and kind of said good luck, some of that friction may have felt unsolvable. And that's one of the things that we try and bring to all of our partnerships that we're involved with, is actually that closeness, that collaboration, where we're not a vendor who's giving someone a license to something. It's actually more deep than that, in terms of actually trying to unlock value by figuring out hairy problems like this one.
Yeah. I think it's a really important point that we'll come back to in terms of the ways of working and the sort of the approach to selecting a provider and how it differs to more traditional sort of procurement processes, as you say, Chris. I just want to check if either of you, Anna has said, I understand mostly how you might put a model of practice program online to support remote communities, but I'm keen to understand accessibility devices and Wi-Fi, capability and capacity of people with severe and enduring mental health challenges, especially of people who have sophisticated needs. Um, I guess that's kind of like, making a nod to the complexity of some of these client groups and what that means for their ability to receive, as well as some of the more infrastructure challenges. I think we've just touched upon it, but is there anything else you want to add in response to Anna's question?
I think I just add in that, we do support a lot of clients with very complex needs through the tech, and it's about understanding how they're coming to the process and supporting them through that, being willing to support them through. But actually, once they've mastered it, they're fine. So there's a wide range of clients we support, not just the offenders who do have quite serious mental health issues. And they are able to navigate it, and that sense of empowerment from being able to make some choices as well. But I think it's about not just assuming it's easy for everyone, and being really respectful and creating the time to guide them through the process and coach them through. And there's certainly some clients where we do have people who will check in on them, ring them, just make sure that they're not struggling, make sure this is working for them. So we do have sort of care support teams as well, who will sometimes, with some of our cohorts, but just doing a little bit of checking in on the background as well. So I think, we can't underestimate, for people who struggle with life generally, they can struggle with tech, but also there's a huge reward if they can master it.
And just to build on what Jacinta saying, what I like about the way that Jacinta and her team have done the service design is there's different variants of this program. So there's an individual pathway as well as a group pathway. There is an offering of doing it face to face. And one of the things that we did from a technical point of view was we supported who was holding the pen, if that makes sense. So there's certain scenarios where the individual maybe isn't comfortable typing kind of answers or creating kind of completing activities themselves. So the actual clinician who's facilitating that session can, transcribe essentially what they're saying and complete it. So by having some of that adaptability and flexibility, I think that's a big part of being able to cater to a wide set of needs, knowing that not everybody's going to be comfortable with a particularly like rigid pathway. So I think that's a really great part of Kickstart, and obviously Power to Change, other programs that Jacinta runs as well, follow that same principle.
Mm, in these webinars, we talk a lot about meeting people where they are and thinking about kind of, it's not a case of one approach or one size fits all, but rather it's about adapting to the client and learning and iterating, as you say. But equally, not allowing your own preconceptions to stop you from trying something if you can then get to a potentially better place, particularly in the context of workforce challenges and access. Um, I want to just remind the audience, because I know that there are a couple of hands up, which is new. Just to remind people to ask questions, if you can use the Q&A box, that would be really helpful, and I will come to the questions as we progress through the discussion. I want to change tack slightly, Chris, to focus on sort of more of the approach to working with a tech provider. I'm sure we will have a number of people that are joining this webinar today who will be very familiar with their organizations needing or wanting to select a provider and having to go through quite a traditional procurement process. I think it would be really helpful for you to reflect on that process versus the kind of type of approach that you're describing.
Yeah, and I think, don't get me wrong, I don't think that doing that formalized selection process is a bad thing. I think it's a good way to canvas and understand who's in the market, collect some information around commercials and other aspects, etc. So that definitely has a place and a role to play. But if I reflect on, the work we do with Jacinta, the work we do with ProCare, Youthline, Steps Together, one of our customers in the UK, I'm just throwing out GCS, another one. They all followed similar traits, which was there was an assessment process and a formal, a selection process, and people have approval steps and budgeting and all of those things. So absolutely those things need to be done. But what I think's allowed us to be successful in those partnerships is that we've found a kindred spirit in terms of a partner who actually wants to leverage some of our knowledge and expertise. Like my background, my team's background is in software, AI, data engineering, not in mental health care delivery. So we've got no opinion to bring to the bear around this is how you should run your service or your program. And we would never try to do that. But where I think we do have skills is in the ways in which you can think about how digital can support these different pathways, how you can unlock the value from your data, where you can find efficiencies. And I think so that's been the big kind of thing for us in terms of partnerships where we felt we could have the biggest impact is from a mindset point of view. It's not a vendor and supplier. If anybody comes to us with a big stack of here's my requirements document and it's very rigid and it's kind of there's no ability to flex or learn or adapt or listen to new ideas, etc. My view is, those are the types of projects which are more fraught to having issues along the way and potentially delivering kind of subpar kind of outcomes because you don't have those learning loops. You're not using kind of the full skill set of the team. So I laughingly joke, with I feel like a fractional CTO half the time when I'm working with our customers because we're just discussing challenges, opportunities, and that can be with legacy kind of stacks and solving problems as well as innovative type things. But that's our mindset at Tacklit, and that's one of the things that we've, I think, found is allowed us to help our customers kind of, as much as we can is finding those kind of those partnership oriented approaches, not a vendor supplier type relationship. That's my big takeaway.
Yeah, it's really interesting because there's been some information coming out of the Nordics in relation to that kind of very transactional approach that you describe and what the impact has been to healthcare professionals actually, and healthcare professionals choosing to leave because of how unfriendly the tech is and that cognitive load element. And I think Jacinta, again, we have reflected on this in our discussions prior to this panel, and I think it's really worth reflecting from your perspective some of those traditional expectations around the challenges of digital transformation and what you've observed amongst your team in terms of how the technology has informed their working practices and what that's meant for morale and cognitive load and retention.
Yeah. And I think certainly there's a couple of elements to that. One is when they first come to the journey and people aren't thinking in new ways, they want to replicate their old ways of working, which is not really leveraging the tech to the best benefit. So early in our piece, there was that desire to we want to do things exactly as we do now, we'll just do it on the platform. Then we moved into a phase where people were actually starting to see that the platform could do things in better ways and we should change some of our processes. And that can be a bit of a tussle to actually get people into that change mindset. And then more recently, we've started to use some AI through what Chris and his team have been building. So we're just starting off really small with a pilot around case noting. And that has seen the biggest shift because the teams are now, we started with a small group of people trialing it to feed back to us because that's the process we like to use. And now everyone's sort of going, well, when do we get to turn it on? When do we get to turn it on? So we've seen that absolute mindset shift where now they can see the benefits, they've had the experience and they want to actually trial new things. So, and AI is everywhere, right? And what we didn't want to do is have everyone just turn it on and start randomly working with it. We wanted to go in a kind of safe, navigated way where as an organisation we were confident we were sort of proceeding with caution. So that's how we've been able to do that. So we're just using verbal notes, and Chris can talk about what Tacklit can actually do. We've just turned on some parts of it, and already the staff are sort of saying, they're spending 30% less time in doing their notes. So that's less admin time for them, but it's also that idea of they can get it out of their head. They can straight after the session, they do a quick verbal note. The AI works on it, structures it into a case note that they will come back at the end of the day and review. But they're not trying to carry that information into the next session. And when you've got 5 sessions back to back and you're pulling information from one client to the next, you're trying to parse it all out. It actually just reduces the cognitive load that they're carrying, and they know they'll come back at the end of the day, review those notes. They are still their notes. They have to sign off on them. And they can be sort of let it out of their head as the day progresses. So, reduce cognitive load and just a reduced admin burden so they can actually focus on the client in front of them.
Chris, did you want to add anything in the context of AI?
Yeah, I think like most in the technology space, we are excited by and are seeing some really valuable emerging use cases where AI can actually kind of unlock huge efficiencies. I think we've been surprised at how quickly kind of in a health context we've seen some of these technologies kind of being adapted, and more so now I'm being asked by our customers for AI rather than me having to go and talk about it. So I think for us, the way we think about it at Tacklit is we're very focused on responsible intelligence. So that's a fundamental for us. So patient safety and risk factors in regards to data, information, decision making, etc. Like you can't compromise on those things as first principles, and that's why I think we're able to do good things with Jacinta and team, because we're in that base platform. We store and control a lot of this information, and it's all encrypted. It's not being sent off to some random third-party organization over here or sent to a big LLM in the US over there. It's more controlled and organized. And the way that we're approaching it is kind of building this kind of team of AI agents, if you like, for our customers to be able to leverage. We're very focused on efficiency and productivity and making the care team's job easier by being able to rely on these agents to do kind of tasks. So Jacinta touched on a note-taking piece that we've delivered. We have session transcription stuff that we do for virtual sessions through our telehealth video consultations. We have safety elements. So we have an organization here in Australia, Raise, utilizing Tacklit for youth mentoring scenarios. So whereby they're pairing a young person with a lived experience mentor. So a big part of the AI there is around moderating the safety aspects from a safeguarding and youth safety perspective. Ingesting referrals is another really big one. You know, lots of people are receiving referral information in all manners of formats, documents, channels, etc., and pulling that in, assessing it, understanding eligibility, checking those things, etc., is, you know, oftentimes requires quite a manual process. So we have an AI agent which does that piece. So yeah, so we're thinking about it as these AI agents to basically support a care team. And what we can do with someone like Jacinta as a leader is we can go and say, hey, these are the AI capabilities that we can kind of enable. And she's got complete control over what her staff are able to kind of leverage. You know, so in terms of, I really like them to be able to use this agent because that really makes sense for us, but these other ones, etc., I'm not going to want them to do that. So I think what we're trying to provide, and, you know, I think most platforms, you know, if your platform provider isn't talking to you about AI kind of today, then they really probably should be, because the risk is if we don't provide that well, the staff themselves will potentially go out and try and solve these problems, and that creates, obviously, you know, Jacinta can talk about the headaches that maybe that provides of somebody using a private chat GBT something or other over here. So that's what we're trying to do, is kind of put it together in a way where it's secure, organized, well thought through, structured from a risk point of view, fundamentally adding value to those team members who are using it to help them essentially help them be more efficient and effective.
Yeah, I think it's actually a really important point, Jacinta, from in the context of, you know, from a governance perspective, how you support and enable your staff to kind of harness the power of AI, which is incredible, but equally presents lots of risk, particularly in terms of data and confidentiality and the use. And so I think, you know, if you could reflect on sort of some of that approach to AI that you're having in Caraniche, but also I think from a consent perspective of those individual service users whose data may or may not be informing some of these this thinking moving into future service developments.
Yeah. So at the moment, we've made the decision as Chris, we're only using AI to support our clinicians. We're not doing any front-facing AI with clients because we're just not ready. When you're running an organisation of multiple people and you're trying to find consistent ways of working, so you're in a sense directing. You're not just creating opportunities for people to take up technology. You're in a sense directing them. You need to take responsibility then for making sure it's completely safe, it's compliant, that you're protecting people's data and privacy, and you're using it responsibly. So what I like about what Chris is doing, because it's all sitting in the platform. So our concern was, and we went through quite a significant process of just mapping what was going on and what the opportunities were. And we're being really quite conservative, but we know that we have to get into it and we have to use it because the staff, as Chris said, will use it anyway. They're using it in their private lives. Everyone's booking their holidays using AI. They can see the power and the benefits. If we don't provide a guided path for, you know, starting to use it in their work, we actually lose visibility and we lose any understanding of the risks that are being taken that ultimately we hold, or I hold, in terms of our patient data. So having it actually in the platform, so that anything that's going out, and Chris can talk technically, you know, it's de-identified before it goes back and then it gets reconstructed when it comes back into the platform. So nothing's going out in terms of data security that can be identified anywhere. It's all kept within the platform, which is so much safer. So from a governance perspective and from a risk management perspective, we're working with Chris in understanding what's the approach you're taking, what are you doing, and we will only turn on the things that we are comfortable turning on. And then we're doing our own pilots. Like, I trust Chris, but we will do our own pilots internally before we make them widely available and just test the user experience for our staff. But at the moment, we're not doing any client-facing stuff. But again, I'm sure it's inevitable that we'll be doing some client-facing stuff, but we'll go through that same process of testing it ourselves, assuring ourselves, because we can't just rely on a vendor's say-so. I can't rely on Chris's say-so, as trustworthy as he is. We actually have to do our own due diligence, and you know, and we have to actually control that pathway for our staff. And because you, as I said, you can't control risks if you don't have visibility of them.
Have you found that conversation's easier though because of the partnership and collaboration? So if you were an organization with lots of legacy systems and unwieldy technology that was making everyone's life harder, I can imagine that having a conversation with AI would raise a few eyes and people would be kind of thinking, yeah, okay. Whereas actually, because of the journey you've already been on, does that mean that people are more open and responsive to the opportunities, but also have that trust and confidence in the team and the platform to enable that approach in a seamless way.
Yeah, I think because they understand where it's going and what's happening with it. And a lot of times people don't always want the detail. They want to know that someone else has thought about it and given it the all
Mm-hmm.
clear. So they don't
Mm-hmm.
actually always want all the detail. But I think we've now been working with the Tacklit team for such a long time that, it's safe for us. It is a much more sensible thing to do it in partnership with Tacklit, in collaboration within the system. So the data's all sitting in one place, then going and getting some bolt on from a vendor who is just there to sell that AI tech. They're pushing it because that's all they've got. Chris isn't pushing it; he's creating it, making it available to us, and we decide whether we want to turn it on or not. That's completely up to us,
Mm-hmm.
and that's a very comfortable journey for us as an exec to be on. That ultimately, it's not being unleashed upon us, and we're not grabbing something that has a commercial imperative to increase or push use. We're actually turning on in a really measured way, and certainly in some other parts of our business, there is tech where it's quite voracious and it is trying to drag as much of your effort and time, and may increase your dependency on that particular platform. And you don't actually always have visibility of the risk, and that's sort of HR type platforms. They're focused on their own commercial success. They're not actually there to support you in the work that you do with your clients. And I think the comfort I take from Chris is it is about making sure the work with the clients is being well supported.
Mm. Yeah, I think what you've described is really you as a team, and you don't hear it very often actually, but you as a team feeling incredibly empowered to make the right decisions based on what's right for Caraniche, as opposed to being led, as you've just described, by the tech company or the vendor because they've got a particular technology they're incentivized to use. I think it's a great point actually, and it's really interesting. I'm just gonna come to a few of the questions in the Q&A box. Just because we've been talking about AI, one of the questions is, does the Australian government fund the development of the AI platform, and how is the platform regulated by the authority?
So yeah, I can try and answer that one. So the Australian government does have some R&D incentive schemes, etc., for not just for AI development, but for innovative kind of technology enhancements that support some of our kind of funding of these things. There are emerging grants and schemes that we've seen not only in Australia but in the UK and other markets that we're in as well, whereby governments seem to be starting to endorse this innovation. We've seen more and more governments now starting to create AI policy in regards to health in terms of more formalized guidelines for how to utilize it and those things, etc. So yeah, absolutely, that thing is that space is absolutely growing. And then in terms of regulation, I think the main ones that kind of exist currently and the ones that we've been most focused on are around that data sovereignty and the protection of that personally identifiable and health sensitive information. I think that's that's a critical factor, that if anyone on the webinar is using AI or thinking about using AI, the first order questions I would be always asking any potential partner is, where does my data go? Is it being used to train somebody else's model? What can you see, can't you see, etc. So that element of it, I think, is really, really critical. And that's not necessarily a new thing, because that exists with any technical system today. But the onset of kind of AI and these point solutions which are appearing all over the place, I think you just got to ask some really good questions as the data controller. As Jacinta as a service provider, she's a data controller, I'm a data processor acting on her behalf. So just making sure that's well buttoned up, I think, is the main advice I would have.
Just as Chris was talking, it made me, earlier in the presentation, you described about how you've got the work from a correctional facility sort of criminal justice perspective, but you've also got the EAP programs. And I was just wondering, from your customers in that space, are they motivated by AI? Are they really interested? Are they driving that? Or is it very much the other way around and you're going to them with innovation?
It's actually really interesting because it's almost a divided, EAP is almost a divided field of the digital first solutions that are very much talking about digital being better, and then the more traditional models of delivery where, we're here in a crisis. When things go terribly wrong in your workforce, or there's deep distress in your workforce, you want to know you've got really good quality counsellors, not necessarily the best tech solution. So there's an interesting debate going on within the different parts of the EAP workplace wellness sector at the moment. I think customers certainly expect to see digital platforms. They certainly expect to see, self-booking systems, what's really quite basic digital support. They want to see apps, they want to see, health information, things like that. I don't know that they're pushing, or certainly our customers aren't pushing for us to be providing them with AI, because I think they're in their own backyard are concerned about the risks of AI, and they're navigating what they need to do in their landscape. So they're not pushing. They certainly have an expectation of digital support, of some sort of app or access to digital information, 24/7 kind of access to information, self-booking, but they're certainly not demanding AI-led type responses. And I think anyone would be a bit scared of that at the moment, because, we're not really quite sure how it's going to work at scale when it's not one practitioner doing it to one client, but when it's actually kind of unleashed, how that's all going to work, I think. So I think everyone's a little tentative in that space at the moment, not pushing for AI solutions just yet.
Yeah, and I think it's interesting because obviously we talk a lot again about digital literacy or digital confidence, as it was described to me yesterday on a panel. But I think AI adds another layer to that, and I think where people don't understand it, there is fear. We have got 4 minutes left. I feel like I could talk to you all day. Actually, it's so interesting, but I do want to get to these last questions. So the first one, and if we could keep the answers to just a minute or so. This sounds like a really successful initiative, although sounds like a very large and expensive collaboration. I run a small mental health charity in the UK. How easy is it to scale these automated processes down to more grassroots organisations, both in delivery and in cost? I think, Chris, that's probably a question for you.
Yeah, quick answer. So yeah, absolutely. We are endeavoring to take the learnings and the lessons that kind of we've distilled through a very hands-on collaboration with Jacinta and team as an example, and make those things kind of more scalable and repeatable with in a lower cost kind of delivery model. I like to think as Tacklit we're pretty good value for money in terms of price, but I'll let Jacinta comment. But yeah, absolutely. We work with organizations as small as 5, 6 kind of practitioners who want to unlock the power of digital to do various things, and obviously the type of engagement and the model has to be right sized. So yeah, all of our toolkit that we've talked about today, we can kind of apply it kind of up and down the spectrum for different care team scale, complexity, different needs. Absolutely. And we're going to keep continuing to improve and enhance those things to, again, make it as accessible as possible. We want to be the leading mental health care platform all around the world, serving all manner of different mental health care contexts. So that's what we spend our days, nights, weekends worrying about.
And I just quickly add, I'm sort of a bit jealous of anyone that comes to the process now, because it's kind of all built in. So our process of discovery has helped, I think, build a great platform that's now just available. So, I'd certainly look at it if anyone was in the market, because what you get now off the shelf has benefited from this whole process. So you don't have to go through the process of discovery. It's already actually happened.
It's an incredible way of putting it. And finally, I just wanted to come to a couple of questions from Nina. Thank you so much for this interesting presentation. You talk about the link between technology and mental health services, but beyond tech service links, could you reflect on what some of the key stages in the roadmap for getting there? What are the stages needed for making digital solutions as an integral part of the system? These are actually quite a few questions. What would be the key elements of such a roadmap? So covering things such as finances, advocacy, policy changes, data laws, links to Ministry of Health, building demand. And then the final question from Nina is the platform open source?
It's probably that you're best to answer that one, Jacinta, on what does it take to get ready for a transformation like this one?
You're going to talk about the open source?
Yeah, we use open source elements, and we have a bunch of APIs, etc., that people can build on. So probably a more detailed technical answer, but happy to chat. Nina, I think it was, who asked the question. Send me an email.
Yep.
That was such a multi-barreled question. I'm not sure I'm going to answer it properly, but I think in terms of getting ready, it's about being clear about what you're trying to achieve and what your pathways are, your client journeys or your clinical pathways. And actually they're pretty standard, aren't we? We take a referral, we do an assessment, we work out a treatment plan, we work out what options we're going to offer. They're not, we're not all doing super magical stuff. There's a fairly consistent way of working across most mental health services. So I think you've got to have clarity around what your service is. You've got to have mapped out the steps and then see where they fit within the platform. But I don't think it's sort of rocket science. I think we're all pretty much doing similar things in similar ways. And the pathways are quite consistent, but you can't kind of just pick up a platform and go, oh, let's make it work. You do want to have already mapped out and be really clear about your service models and your client pathways to leverage it effectively.
Thanks so much, Jacinta. I do appreciate that was a multi-barreled question right at the end, and I apologise. That's bad moderating on my part. I just want to say a really, really big thank you to both of our panelists, Chris and Jacinta, and to our wonderful audience for being so engaged and asking some really good questions. I think what we've really talked about today is partnership, collaboration, working with each other to achieve a better goal that fundamentally supports our service users, whatever setting they're in, to get the care that they need in a challenged, resource-constrained environment, and that actually that partnership approach is key to some really successful delivery metrics. As always, this recording will be on the Knowledge Bank. I'm sure that Chris and Jacinta will be available to answer any questions offline. But thank you so much for your participation and engagement, and have a wonderful day or evening ahead wherever you are in the world. Thank you so much.
Thank you, Fiona. Thanks, Jacinta. Thanks, everybody.
Thanks, Fiona.
Thank you.